Hello, my name is Julisa Romo, and I am presenting the Alice in Wonderland syndrome. What is the Alice in Wonderland syndrome, may you ask? It is a neuropsychological condition that affects a person's perception of the world around them. So this may involve very strange visuals. This syndrome was actually established by a British psychiatrist named John Todd in 1955. He noticed that a lot of his patients were experiencing similar symptoms, so he decided that he would call it the Alice in Wonderland syndrome because a lot of the symptoms that they were experiencing was similar to the kind of things Alice was experiencing. Some of these symptoms involve dysmorphopsia, which is seeing straight lines that appear wavy. So let's say if you see straight lines in your ceiling, they may actually appear very wavy to you. There's also prosopagnosia, which is seeing distorted faces. So if you were to look at one of your family members, their faces may seem a little weird. Or the group of people outside may also appear very weird to you. There's also hemochromatosia, which is super bright colors. So the grass outside may appear actually very, very green, or yellow bus may actually appear very, very yellow. Kinetopsia, which is still objects that appear moving. So let's say there's a lamp in the corner of your room, it may appear that it's actually moving towards you, even though it's actually not. There's also dysmetropsia, which is body parts or objects that seem smaller and bigger than they actually are, or closer or farther away than they actually are. So for example, the clock on your wall may actually appear quite bigger than it actually is, or a body part, let's say your arm, may actually appear very, very small to you. These symptoms can actually last from minutes to days to years or even a lifetime. There is actually no known established causes of this syndrome. However, there seems to be a pattern of individuals who do experience the symptoms of Alice in Wonderland syndrome. Individuals who have migraines or epilepsy, as well as individuals who have temporal lobe epilepsy, the Epstein-Barr virus, and brain tumors who have these symptoms. There's actually only 15% of individuals who have migraines and epilepsy who do experience these symptoms. However, there is no general prevalence rate for the population outside of these groups who are experiencing these conditions. So we don't know the actual prevalence rate for the general population who are actually experiencing Alice in Wonderland symptoms. These symptoms are actually seen in children more than adults. However, some of these symptoms are seen in other conditions like retinal ablation, which is basically when a piece of your retina is displaced from your eye. Labyrinthine is also another condition where these symptoms do appear. We also know that some of these symptoms are associated with cortical areas from V1 to V5. For example, V4 responds to color and V5 area responds to movement. Wonderland syndrome is not actually recognized as a neurological disorder or a psychiatric disorder. So for now, it's in a very gray zone. Not much is known about it, so that's where it will stay for now, for as long as there's not enough information for us to establish if it's a neurological disorder or a psychiatric disorder. In order for a diagnosis to be done, a clinician should be aware of the history behind the Alice in Wonderland syndrome, as well as the symptoms associated with these syndrome. Clinicians should also not confuse the perception symptoms with hallucinations and illusions, as these two things are very different from each other. If the symptoms do occur after an epileptic episode or a migraine, then the clinician should establish with the patient that their symptoms could possibly be associated with Alice in Wonderland syndrome. In order to actually get an official diagnosis, you should visit a neurologist who will run blood tests in order to see if you have the Epstein-Barr virus in your bloodstream. As I mentioned before, the Epstein-Barr virus is associated cause with the Alice in Wonderland syndrome. The neurologist may also run an MRI scan or an EEG scan where they can detect any kind of abnormal activity that could be associated with the symptoms of Alice in Wonderland syndrome. There is no actual effective treatments for the Alice in Wonderland syndrome. However, clinicians do recommend that these individuals avoid any type of medication that may trigger a headache. So, in order to soothe or avoid the symptoms of Alice in Wonderland syndrome, it is recommended that they take antidepressants or anti-seizure drugs as well as blood pressure medication. Individuals may be recommended to change their diet. This involves eating 5 to 6 small meals instead of 3 meals each day, because if an individual eats 5 to 6 small days, there's a less chance of the individual experiencing a headache because of the gap between the 3 meals that you would normally have. So there would be no trigger to the headache, then leading to a migraine, and then possibly triggering the symptoms of Alice in Wonderland syndrome. The doctors may also recommend that the individuals avoid alcohol, softer aged cheese, as well as processed meats, since we know that these three things are associated with headaches. An individual may also be recommended to eat fruits, vegetables, meat, poultry, eggs, and fish to sustain a very healthy diet and to avoid the symptoms of Alice in Wonderland syndrome. So what is the future of Alice in Wonderland syndrome? Well, as of right now, we know there's only 169 cases reported of Alice in Wonderland syndrome seen in individuals since 1955. This syndrome is very underreported because it is misdiagnosed with other conditions instead of it actually being diagnosed to Alice in Wonderland syndrome. And a lot of neurologists, clinicians, researchers aren't super aware that Alice in Wonderland syndrome exists. So that could be another cause as to why it's very underreported and misdiagnosed. So in order to kind of avoid these problems, it's important that research is further done for this syndrome in order to find any underlying causes. So then we can help individuals who are experiencing the symptoms that don't have diagnosis, and for further individuals who may have these symptoms and may actually have Alice in Wonderland syndrome and may not know it. And that concludes my presentation of Alice in Wonderland syndrome. I hope you enjoyed.